Okay. Good morning and good afternoon, everybody. I am Eva Slawecki, the Interim Executive Director of the Canadian Association for Global Health, CAGH. We are an organization committed to mobilizing the global health community to create a healthier and more equitable world. CAGH is excited to be co-hosting this webinar with the Canadian Network for Neglected Tropical Diseases, or NTDs. The Canadian Network for NTDs is a vibrant network of interested Canadian individuals and organizations who mobilize Canadian action to end suffering from NTDs. Our offices are situated in Ottawa, where we are working and learning within the traditional and unceded territories of the Algonquin Anishinaabe people. As we are gathered here virtually from all parts of Canada and the world, I invite you to also take a moment to reflect on your ancestors' lands and the traditions of where you live, work, and play. During this International Development Week, we have the opportunity to present an extraordinary panel of speakers who are committed to addressing the impact of neglected tropical diseases, which impact more than a billion people across the world, primarily those living in poor or marginalized communities. Today's webinar will focus on addressing NTDs for the health of women and adolescent girls. Please use the chat and Q&A functions on the Zoom platform for your questions and comments. Our team is monitoring those and will bring those to the attention of the speakers as needed. Pour nos collègues français, n'hésitez pas à faire vos commentaires et questions en français. Nous pourrons vous répondre en français ou en anglais, comme vous voulez. And with that, it is now my pleasure to introduce our moderator, Dr. Alison Krentel. She is Assistant Professor, University of Ottawa, School of Epidemiology and Public Health. She's a scientist at the Bruyere Research Institute and co-founder and chair of the Canadian Network for Neglected Tropical Diseases. Alison's research introduced, sorry, my dog is barking in the background. Challenge of working from home. That's it, she's trying to participate. Alison's research interests include maximizing community engagement and ownership in mass drug administration programs, using implementation research to support health systems, and translating research results into programmatic action. Her current research includes projects on lymphatic filariasis and female genital schistosomiasis. Oh my gosh, you could tell I'm not the expert, I'm sorry. In Ghana, Guyana, Indonesia, Madagascar, and Papua New Guinea. So with that not so graceful introduction to you, Alison, please, the stage is yours.
Thanks so much, Eva, and thanks to your dog. And I think you've definitely highlighted some of the challenges we have with neglected tropical diseases. Some of the names are very hard to say, so don't worry. My PhD supervisor, I don't think ever managed to say filariasis after 4 years. So I'm going to just share some slides this morning and just very quickly just give a very brief introduction to neglected tropical diseases. And also, as this is a largely Canadian audience today, talk about what Canada is doing to address them. So next slide, please. So in my sort of 8 minutes that I have allocated, I'm just going to very quickly talk about NTDs. You'll hear that word instead of neglected tropical diseases, tell you a little bit about who the Canadian Network for NTDs is, and also just introduce the focus of the webinar and why we felt it was important to have this during International Development Week. Next slide, please. So neglected tropical diseases are 20 infectious and parasitic diseases and conditions that are identified by the World Health Organization. They affect 1.7 billion people around the world. That's the equivalent of about 1 in 5 people. And they largely are diseases of disability and disfigurement. They do cause some mortality, but largely their impact is morbidity and quality of life. Infection with NTDs results in productivity losses, higher healthcare costs, reduced economic potential over the life course. For those who live with chronic manifestations of the disease, you can see here in trachoma is blindness, onchocerciasis or river blindness can cause blindness as well. You can see here in the lower left corner lymphatic filariasis, which can cause elephantiasis and lymphedema for individuals who have the chronic manifestations of that disease. And so individuals living with those chronic manifestations may encounter stigma, social isolation, and discrimination. NTDs are known as diseases of poverty. They can trap individuals and their families in intergenerational cycles of poverty. And today we'll be focusing on schistosomiasis or bilharzia, maybe a name some of you have heard, and soil-transmitted helminths. These 5 diseases that I've put here, the 5 of the 20, are addressed through preventive chemotherapy, which is administered through mass drug administration. Next slide, please. So the impact of addressing NTDs on the Sustainable Development Goals, and I've just highlighted, this is actually from the WHO roadmap. On the left side of the screen, you'll see the successful interventions against NTDs will contribute to various other Sustainable Development Goals. Goals around poverty, hunger, education, gender equality, decent work and economic growth, as well as reduced inequalities. And then we have these 4 here in the middle where progress on the other Sustainable Development Goals will help us to achieve our NTD goals. Goals around water and sanitation, sustainable communities, climate action, and industry and innovation. We know that we cannot reach our goals for neglected tropical diseases without strong global partnerships in the NTD community. Those exist with the pharmaceutical industry, national ministries of health, academic institutions, NGO and CSO partners, philanthropic, and also national governments who contribute funds. So addressing NTDs, we know, has a direct impact and is also part of goal number 3 for good health and well-being. Next slide, please. We're going to be talking in our we have 3 kind of mini talks this morning or this afternoon, and we're going to be talking about the different impacts of particularly soil-transmitted helminths and schistosomiasis on women and girls over the life course. And I'll just show this slide to highlight the risk that continues throughout a woman's life. It may change due to her gender roles, and how she may have contact, for example, with infested water for schistosomiasis. So you'll see variation of risk across her lifetime, and also the impact of NTDs will change. And we see in the later life times the stigma, social exclusion, and economic loss that may result because of an NTD. So we'll look at this in more detail in the talks that are coming up. Next slide, please. So how do NTDs overlap with Canadian global health priorities? And I've highlighted here on the left side of the screen the WHO roadmap, which that for 2030 to help reach the goals related to neglected tropical diseases. The roadmap was endorsed in November of 2020 by the World Health Assembly and then was formally launched in 2021. In fact, the Minister of International Development at the time, Karina Gould, spoke at that launching event. It outlines the targets that we need to take across the 20 diseases to attain the SDGs. And it overlaps with Canadian Feminist International Assistance Policy, or what we call here the FIAP. The overlaps are clear, and I've put some in the middle there to show some of the clear overlaps between the roadmap and Canadian goals for international development. One of the things we're going to talk about today is how Canadian programs can provide platforms for deworming and other NTD services, as part of an integrated approach. Key in all of this is equity, and particularly gender equity, as a goal for both the roadmap and Canadian investment priorities. Next slide, please. So who are we? Eva introduced us a little bit, the Canadian Network for NTDs. Our vision is a world without NTDs. We are over 150 individual members, both from Canada and abroad, guided by a steering committee with representation from across different stakeholders here in Canada. Some of our activities include raising awareness here in Canada, facilitating collaboration across our membership, both within Canada and outside of Canada, and also providing technical advice on NTD related questions for a Canadian audience. And if we don't know, we certainly will connect with global experts who will help us find the answer. Next slide, please. So what are Canadians doing to address NTDs? And I'm just going to highlight 3 areas, because this is an area that NTDs haven't really been a primary focus. But there's been so much work that's happened in Canada. And so we just want to highlight what Canadians are doing. Next slide, please. So we conduct research. This is a graph that's come out of a paper that we published a year ago. Canadian researchers are working across all 20 of the neglected tropical diseases, with an average of about 165 publications a year. And we suspect that this underestimates the production and innovation that Canadians are contributing to the global NTD goals. We contribute innovation, partnerships internationally, networks, our contributions to the WHO goals and policies, and as we'll discuss this morning, the deworming policy. We contribute both across the bench sciences and social sciences. Next slide, please. There are programs to prevent and treat NTDs and assist people with disabilities. Groups like Affect Hope, you'll hear from Nutrition International this morning, SEVA and Orbis, working in trachoma, and then groups like WaterAid, who are looking at water and sanitation, which have a direct impact on NTDs. Next slide, please. We also raise awareness, and just a highlight from the recent activities on World NTD Day. So working together with parliamentarians, civil society organizations and researchers, students and young professionals to raise awareness about NTDs and why it's important to consider them in our Canadian goals and priorities. Next slide, please. So on January 30th, we had World NTD Day. It was the 3rd World NTD Day. And you'll see here some of the highlighted monuments. There were over 100 monuments and landmarks that were illuminated in purple and orange in over 30 countries. So an incredible global movement that took place to highlight the importance of NTDs and to bring awareness across the world and galvanize commitments and support for the elimination, control, and eradication of NTDs. And just a real recognition of what that partnership looks like. So as one of the activities of World NTD Day, the World Health Organization launched, and if you can go to the next slide, please, launched this policy brief, the Deworming Adolescent Girls and Women of Reproductive Age policy brief. It was launched as part of the World NTD Day celebrations. And we really felt when this became available, we really felt that this had high relevance for a Canadian audience. And so as the network together with CAGH, we wanted to take advantage of International Development Week and highlight this document and its relevance for Canadians. So with that, I will end my remarks and introduce a short film produced by the World Health Organization that will introduce for you the importance of the 2 NTDs that we'll be looking at today, soil-transmitted helminths and schistosomiasis, and their relevance for women and girls. Thank you. Great. So that introduces you to a little bit of the what we're going to be talking about. It's my pleasure to introduce our next speaker, Dr. Amadou Garba, who is the focal person for schistosomiasis at the World Health Organization's Department of Control of Neglected Tropical Diseases in Geneva, Switzerland. Dr. Garba is a clinician with research and public health experience and has worked for more than 25 years on the research and control of schistosomiasis and other neglected tropical diseases. So welcome, Amadou. The floor is yours.
Thank you, Alison. I would like first to thank the Canadian Network for NTDs for inviting me to give this presentation on schistosomiasis and its impact on sexual and reproductive health. So as you know, schisto is a neglected tropical disease, a waterborne neglected tropical disease. It is endemic in tropical and subtropical countries. And to date, we have 38 countries that are endemic. And out of them, 51 need preventive chemotherapy, meaning mass drug administration. So 241, almost 41 million people need this treatment worldwide. And 91% of them live in the African continent. In addition to the 78 countries, also, we had reports from Nepal, Myanmar, and India about transmission of the disease. However, we need to confirm that. What about the cycle, the life cycle, and the group at risk of schisto? So the cycle starts with infected people that release the eggs of schistosomiasis eggs in urine or in feces in water. So these eggs are going to hatch and release a larva called Miracidia, which is going to penetrate snails. And after a certain period of time, these snails are going to release the infective larvae, which is the Cercaria. So when people are in contact with water for any reason, for leisure, for working in their rice field, or for fishing, or for women also, and young children, when they came to wash their dishes or clean or take water, they can get contaminated, and the cycle is completed. So for the intestinal schistosomiasis, the eggs are the worms are going to be in the mesenteric vessels, while for urinary schistosomiasis, they are going to be in the venous plexus of the bladder, so in the lower basin. So the people that are at risk and are mostly school-age children, preschool-age children that go to the river or to the water canals with their mother, but also adults also are considered to be at risk. And in some areas, I can say that the entire community is at risk of schisto. So what are the clinical signs of this disease on the genitals? So genital manifestation can be in male or female. Yeah, but the most, I think, important part happen in women. So the disease starts with the transmission here on this first photograph, where you can see that women, a young girl and adolescent are in contact with water. And after a certain period, the first sign of the disease, which is blood in urine, is observed. But this means that the eggs are placed in the bladder and also the genital organs. So the disease can manifest as dysuria, discharge, dyspareunia, contact bleeding during intercourse also, and also anemia and irregular period. This can, without treatment, lead to complications such as infertility, subfertility, fallopian tube obstructions, ectopic pregnancies, with the consequences of bleeding and maybe death if there is no appropriate care. It can also imply a fistula, urine incontinence, abortion, low birth weight, etc. And also, much most importantly, female genital schistosomiasis can also increase the risk of transmission of bacterial infections, HIV, or HPV. However, what we notice is that the morbidity due to FGS is underestimated globally because we don't have sufficient data, and also the diagnostic tests are not good enough to diagnostic them. However, we know that out of the 112 million people infected in Africa, 50% are women. So we estimate that at least 56 million women are at risk or have female genital schistosomiasis in the African continent. And in the 50s, a South African researcher, Jeff Gang, said that it may be assumed that if a patient has urinary bilharzia, the probability is that she will also have an ova of S. hepatobium in some portion of the genitals. And this is from his observation during autopsy carried out in South Africa on people living in endemic areas. Yeah. So what about the mortality also due to FGS? I've said before that female genital schistosomiasis can lead to obstruction of fallopian tube, ectopic pregnancies, etc. And we know that abortion represents almost 8% of causes of maternal death. And also we have 50% also of cases of ectopic pregnancies that are associated with schistosomiasis from a study carried out in Zimbabwe. So it's really, I think, an important portion of the mortality due to schisto, which is not taken into account in the burden of disease estimates. And it's really important to think about because the mortality due to schisto is much more than what is reported, due especially to this problem on the woman genital tract. Conclusion, I will start with, I think, a good point, which is that preventive chemotherapy with praziquantel is a mean to prevent the development of FGS lesions in school-age children. In women of reproductive age, the treatment with praziquantel can also prevent and reduce the FGS lesions. And this comes from many case reports. And we also know that there is really a big need of integration of FGS prevention to existing service delivery platforms, such as HIV and STH programs, the cervical cancer screening, HB vaccination, for example. And also there is a need in terms of research to continue assessing the burden and the mortality due to FGS. Thank you for your attention.
Thank you so much, Amadou, for giving us an overview of schistosomiasis and its importance for women and girls in terms of female genital schistosomiasis. We'll turn over now to our next speaker, Dr. Teresa Georgos, who is a professor at the Department of Epidemiology, Biostatistics, and Occupational Health in the Faculty of Medicine and Health Sciences at McGill University. She's also the director of the WHO Collaborating Center for Research and Training in Parasite Epidemiology and Control, and she is a steering committee member of the Canadian Network for NTDs. So I will hand over to you, Teresa. The floor is yours.
Thank you so much. Hello, everyone. I'm going to be talking to you about soil-transmitted helminthiasis. Next slide, please. Just to keep in mind, this is the kind of environment in which I worked in Peru and which encapsulates the type of environment in which soil-transmitted helminths, the most prevalent of all the neglected tropical diseases, exist and are transmitted in over 100 countries in the world. Next slide, please. Taking us back to 2001, the World Health Assembly endorsed this resolution, and it was endorsed unanimously by all member states, including Canada. And it sought to ensure access to essential drugs for schistosomiasis and soil-transmitted helminths in all health services for women and children who live in endemic areas. And the goal at that time was that there would be coverage of preventive chemotherapy of these essential deworming drugs to at least 75% of women and children. And in those days, the first priority was towards children. And now we are turning our attention more towards women. Next slide, please. So this is just a little primer to show you what a hookworm looks like, what a whipworm looks like. These are two of the soil-transmitted helminths that cause anemia in girls and women. It exacerbates malnutrition. Don't forget, these parasite infections occur in malnourished populations of the world. And it also has been shown to cause absenteeism from school in school-aged girls and boys. During a woman's lifespan, the consequences of soil-transmitted helminth infections are most clearly seen during pregnancy. And this type of infection has important consequences in terms of exacerbating the anemia of pregnancy and in causing low birth weight and neonatal mortality in the newborns of the women. Next slide, please. Oh, I just wanted to draw your attention also to that little graph at the bottom of the slide, which shows you the age prevalence curve, so that in the school-aged population, the peak prevalence has been achieved, and that prevalence remains stable throughout then the life course. Next slide, please. So why is deworming of pregnant women important? It's important because there are about 70 million people in need of deworming who live in these areas where soil-transmitted helminth infections will have an effect on the health of women, especially pregnant women. Over 25 million of these women live in an area where there's a higher than 20% prevalence of whipworm and hookworm infections, causing disability adjusted life years, of course, in this age group. Worldwide, the prevalence of anemia in pregnant women as of 2019 was over 35%, of course, much higher in the worm endemic countries of the world. Even moderate intensity whipworm infection, we have shown in that setting in Peru that I showed you the picture of in the first slide. We have shown that even moderate intensity whipworm infection is associated with maternal anemia, over and above that anemia caused by hookworm infection, which is the main cause of loss of blood from these parasite infections during pregnancy. Recently, there have been research has demonstrated that, in fact, deworming reduces the mortality and morbidity in newborns of women who have received deworming during antenatal care. And lastly, deworming for adolescent girls and pregnant women and women of reproductive age is now shown that it will contribute to the overall goal of eliminating these infections worldwide by 2030. Next slide, please. This is the current WHO recommendations on deworming during pregnancy. It's included in a guidance book published by WHO in 2017, where in this book, they explain the guidance for all of the at-risk groups. So the preschool age children, the school age children, and women of reproductive age. Here's the guidance for specifically pregnant women after the first trimester. And keep in mind, WHO does not recommend giving drugs to women in the first trimester, so that these guidance is always for women, pregnant women in the second and third trimester, where the baseline prevalence of hookworm and whipworm infection is 20% or higher, and where anemia is also a severe public health issue. Next slide, please. So after 2017, I was able to organize a meeting in Villaggio in Italy, where we specifically focused on worm infections in women of reproductive age and adolescent girls. So that group focused on what should we do about it. And we came out, one of the most important things that came out of that meeting was a declaration which said that every girl and every woman of reproductive age who is infected with soil transmitted helminths has the right to be treated and must be considered by preventive health services in endemic countries. Next slide, please. So, as Alison mentioned, we have recently, WHO has recently launched a specific guidance for women of reproductive age and adolescent girls. And it was launched last week as part of NTD 2022 celebrations. And there was also at that time a webinar to launch the policy document. Canada is very much interested in ensuring and contributing and supporting this policy through research, through public health action, and in any way we can. Next slide, please. Of course, this is one of several global health movements and campaigns that want to achieve the Sustainable Development Goals. And by supporting deworming programs, we are impacting not just the Sustainable Development Goal, but many other Sustainable Development Goals, as Alison mentioned earlier. And so as Canadians, we are contributing, I think, to all of these initiatives that I have here on this slide. Next slide, please. And lastly, just to come down again to pregnant women, these are some of the women that participated in some of my research in Peru, and I think this is what we need to keep in mind. This public health intervention is safe, it's effective, and it really does improve the health, not only of the pregnant women, but of their children. Thank you very much.
Thanks so much, Teresa. And thanks for reminding us, to quote Bill Fahey, to see the faces of the people that we're talking about. So thanks for bringing that in at the end. It's really vital to what we're doing. So next, I'd like to introduce Dr. Marion Roche. She is a senior technical advisor in the adolescent and women's health and nutrition part of Nutrition International. She's based here in Ottawa. She leads the design, introduction, scale up, and evaluation of adolescent nutrition interventions, which is a growing area of interest and investment globally. She's also a steering committee member of the Canadian Network for NTDs, and we're delighted to hear from her today what Nutrition International is doing as part of its work as a NGO, global NGO partner in deworming and nutrition. So over to you, Marion.
Thanks so much, Alison. I'm happy to be part of this event today. And I think for me, this is such an important area. When we think of neglected tropical diseases in adolescents, we're not only thinking about neglected tropical diseases, but we're also thinking about one of the groups that has been most neglected by the health system. When we think of adolescents and adolescent girls more specifically, they're often among the least likely to access the health system for preventative services. And for years, they haven't been the attention of health promotion or health service delivery efforts. So I think this is a group that we're really trying to focus on improving their health and nutrition and well-being. Adolescents make up 1.2 billion of the population. That's about 16% of the global population, but they haven't often been the focus of many of our interventions. So I'll focus today on just sharing some of our perspectives from Nutrition International from our work in looking at WEFAS, so weekly iron folic acid supplementation, and deworming to improve the health and nutrition of adolescents. Next slide, please. So our programs are focused mainly in 5 countries in Africa and 5 countries in Asia. Where you see the programs in red, that's where we work really alongside with ministries of health and ministries of education to help them implement their own guidelines and policies, such as the guidance documents that Dr. Teresa had shared earlier with the guidelines around deworming. And we also help them implement the World Health Organization's deworming for guideline for weekly iron folic acid supplementation, as well as nutrition education. In areas in blue, that's where we have some of more innovative projects where we're also trying to add on reaching adolescents outside of the health system with things like digital intervention, social media, even community-based platforms such as a pilot that we had with Girl Guides. Next slide. So when we think of adolescents and that this group is not often accessing the health system, one of the best opportunities to reach both boys and girls is in schools. We can reach the enrolled students, but we also can sometimes use this platform to reach the non-enrolled students by engaging siblings, to reach their out-of-school brothers or sisters, or also to, sometimes have events at the schools that are in communities. But one of the greatest challenges is that there are many who are not attending school or not attending regularly. There are some other opportunities to reach adolescents with, HPV vaccination programs are emerging in many countries. There may be social protection programs in place. I think among the different health areas, I think sexual reproductive health really has kind of the best engagement with adolescents and a longer history of trying to reach them with HIV/AIDS education, different sexual reproductive health information and services. But sometimes that is why there may be more stigma in accessing health facilities. But we are increasingly trying to look at increasing the youth responsiveness of facilities, making sure that there may be health outreach, mobile health clinics, or things like ensuring that facilities are actually open at the hours when students are outside of school or in hours when adolescents may not be working. And we're trying to reach adolescents with digital technologies with more and more cell phone ownership or access to social media. Next slide, please. So our focus on anemia reduction really got a lot more attention in 2017, and that was when the World Health Organization released a report looking at all causes of disability-adjusted life years, so morbidity and mortality for adolescents. And you can see the 2 circled bars in red and blue. For the first time, iron deficiency anemia was recognized as the #1 cause of disability-adjusted life years for adolescent girls. Next slide, please. So our programs at Nutrition International really looked at a nutrition-specific approach, so interventions that would directly impact, improve nutritional status, so our weekly iron folic acid supplementation to reduce anemia, and nutrition education, and that included information on physical activity, healthy snacking, dietary diversity, ranging with also understanding menstruation for girls, their increased iron needs due to loss of blood, also understanding puberty, growth, and development in general for both boys and girls. And part of this is also understanding hygiene and wash and deworming and other interventions that may be offered at their schools. And we also look at broader nutrition sensitive interventions or things that have a greater impact on long-term nutrition. Keeping girls in school is one of the best interventions to improve their long-term nutrition. We also really look at deworming and wash. So wash being the water and sanitation and hygiene aspects to reduce kind of the transmission and exposure to different, soil transmitted helminths. And then this is often accompanied by deworming campaigns, which are often offered twice a year in schools. And if we're already in schools with the weekly iron folic acid supplementation, where they get 1 supplement each week, it's easy to then add on a once every 6 months deworming supplement where that's recommended. And the guidelines show that that's recommended in most settings where we're working. And we also support with menstrual hygiene management, clean latrines and things so that, there's less barriers to girls attending school. And on a broader level, we're really trying to provide advocacy on the nutritional benefits of delaying early marriage and adolescent pregnancy to help keep girls in school. The next slide, please. So with the support of the Canadian Network for Neglected Tropical Diseases, we put together a frequently asked questions guide on deworming. Dr. Teresa mentioned the guidelines that came out in 2017 from the World Health Organization. But for many people, frontline workers, and in many cases, teachers and health workers, they might not be quite familiar with what this means, and especially for adolescents. So we put together a guide specifically asking questions around what these new guidelines meant for adolescents. And it's a guide that can serve for teachers that are often, with the support of the health system, delivering a health intervention in an education setting. And this is available on our Nutrition International website. Next slide, please. Now, one of the challenges is that when we think of COVID-19 for adolescent nutrition and health, I've spoken about how the school platform and the partnerships with the education sector really made it, the most effective way to reach a larger number of adolescents. But suddenly with COVID-19, suddenly almost all of the adolescents were out of school adolescents, making them all much more vulnerable and decreasing access for many adolescents to access to health and nutrition services that would be delivered at school. We also saw really a decreased focus on health and nutrition and well-being, with health systems locally and globally really shifting around COVID response. There were supply chain interruptions. This would have been true for both the weekly iron folic acid supplements and deworming supplements. This was compounded by increased food security in households, with supply chain issues and even just increased poverty for family with lost wages. And this resulted in a decreased coverage in WEFAs that we were able to measure. And we also know that many students missed certain deworming campaigns. And I know there's global efforts to see, on catching up on those. We saw in many contexts, we were able to see an increased risk in the prevalence of anemia for adolescents because of access to, both services and just increased issues with health and well-being and the greater poverty that came with this. And I think one of the most striking things is before COVID, there were 130 million adolescent girls not in school. But during COVID, it went up to 743 million adolescent girls out of school. And unfortunately, it looks like about 11 million of those will never go back. So those dropouts will have continued impacts on health and well-being for adolescents. And part of this is from a rise in early marriage and pregnancy, gender-based violence, engagement in exploitative and low-paying jobs for adolescents. So COVID-19 has really caused us to further reflect on how we can reach this neglected group, but also the vulnerable within this group, and realizing the need to really strengthen health systems to be more youth responsive. Next slide, please. So our lessons learned is really for adolescent nutrition and health to advance, we really need an enabling and policy environment, and multi-sectoral collaborations are key. We really need to engage both the education and health sectors. The school delivery platform is most cost effective compared to community platforms. But we also need to improve on the health system as well. And we need age and context specific information for adolescents from 10 to 19. They are a diverse group within school and out of school, and some of them being married. And we know adolescents are highly influenced by their peers, with this increasing more as they get older, but parents are still incredibly relevant and need to be engaged in our programs as well. And I think a key opportunity is really working with peer adolescent girls who can often reach other colleagues who can be part of delivery of different interventions, and also nutrition education or key messages. And we've had a lot of success with involving girls as peer mobilizers, and also in helping us design some of our behavior change intervention or key messages, and also on social media as well. But I think a challenge for us in reaching girls with health and nutrition interventions is really looking at those out of school girls. I think COVID really challenged us to reflect on, how reliant we were on the education sector, and that we really do need to strengthen the health systems to be more youth responsive, so that they're able to access preventative and curative services. Next slide. So we see key opportunities in adolescents for really protecting their future and current health and nutrition. They've often been framed as, future mothers, but I think it's time from a gender equality perspective to really see their current value and protect their current health and opportunities to do well in school. And adolescence is also an age and stage where they're forming lifelong hygiene, nutritional, and lifestyle behaviors. So it's a key opportunity to intervene. And we also see this as being a critical window for promoting gender equality and girls' empowerment. It's often a time where, girls, things start to get worse for girls, and their peers, the boys, move ahead as the girls don't have the same opportunities. I think that's the final slide there. And thank you. I look forward to questions and any comments.
Thanks so much, Marion. And I think you've given us an excellent example of where another platform can be used to incorporate deworming and NTD services. So thanks so much, and also for that focus and highlighting the importance for adolescent girls. What I'd like to do now is just as you are thinking of your next questions that you want to ask, we have some time for discussion and questions, but as you're thinking of them, we're just going to play a short video from, again, from the WHO launch meeting last week that kind of summarizes the points that Amadou, Teresa, and Marion have raised in their presentations. So as you listen to this short video, please prepare your questions or comments, and we'll address them immediately after. Great. Excellent. So I'll invite fellow panelists to turn your cameras on, and we'll take some questions from the floor. I know that I had one that came in before actually we started today on the integration of HPV and FGS services. So I believe that Teresa Norris is here from HPV Global Action, and she was also involved in the deworming document that we're talking about today. So I want to just give Teresa Norris a chance to talk about the integration, and then I see we've got a question after that. So Teresa, if you're on the line.
Yeah, sure, great. Wonderful to be here and see all of you and be integrated into this conversation. I'm coming from the other side of the field, where my team that I'm the founder and president of HPV Global Action, and we've taken a keen interest on combining and synergizing disease responses for families, really. We saw that with this very aggressive elimination of cervical cancer strategy that we adopted a little over a year ago, there was an interesting opportunity while you have a speculum in place to do much more while you're there. So this concept of having a package of services really seemed very appealing to our group. And this is where we decided that we would integrate both the screening of cervical cancer and of female genital schistosomiasis at the exact same time point. And we'll be testing out a deep learning tool, automated visual evaluation for both. So this is a very seasoned tool in the cervical cancer space. It diagnoses with accuracy high-grade lesions. So now what we want to see is in some regions, we're seeing that there's less understanding of FGS, and due to all kinds of elements, including lighting and just sheer understanding, we're seeing that maybe we don't have as much insight on where there's female genital schistosomiasis, what kind of female genital schistosomiasis. So we're not so much focusing. Yes, we're going to be going to endemic areas where it's both endemic cervical cancer and female genital schistosomiasis at the same time. But what we're interested in really looking at is seeing if this proof of concept can be scaled up so that this can become an adopted routine screening for women So we'll be focusing on our first initial project on women between the ages of 25 and 45. And this can be elasticized once it's scaled up, and we could look at different age groups. But I think what's more important is that this idea of combining disease responses is such an important topic. And I'd like more and more to see the HPV community jump in. When we did our presentation with Amadou last week, I guess it was, my colleague Erin referred to us as we're sisters. You know, HPV is the big sister, and we've got female genital schistosomiasis as the little sister that's been looking for a big sister for quite some time. So we're very happy to see that there's such a sense of collaboration within the community. But I think that there's also, you know, aside from mass drug administration, which is how, you know, we're pushing forward with praziquantel, I think that there could be an interesting opportunity for lower income countries and middle income countries to have a more formal screening in place that's a little bit more global. And then the goal will also be to add deworming as well to this screening project that we're doing.
Thank you, Teresa. Yeah, thanks so much. And I think you've highlighted yet another area of potential integration that's super important, and one that's very relevant, certainly within the sexual reproductive health field. I'm conscious of a couple of questions that have come in, so thank you for raising that. And certainly, if you go to the document, you'll find some more also on potential interactions with HPV and FGS. So we have a question about, we've talked about adolescent girls, but also a question wondering about women beyond adolescence. Who are some of the hard to reach groups that may be missing services for prevention and treatment of STH and schisto? So maybe Amadou, I'll hand to you for hard to reach groups for schisto, and then Teresa, if you have anything to add on the STH side, that would be great.
Thank you. So I think this is why really WHO emphasize on preventive chemotherapy, which is the mass drug administration of medicine in all communities that are endemic for the disease. Treat in schools, but also in communities, all the age group that are in need of the treatment. This is the first strategy that we are using. And the second one is, which is really recommended by the policy document that we have released 2 weeks ago. It is about taking any opportunity of contact between these women or adolescent girl with a health facility for any kind of service. This is what we explain by saying that all the delivery platforms should be used in order to deliver the intervention, meaning the deworming tablet. And by doing so, we combine preventive chemotherapy, we combine also with the use of existing platform in routine, so that we can increase and have a really good coverage of deworming.
Yeah, thank you. And I think that in Marion's presentation, she highlighted one of those groups, of course, are the adolescent girls that are outside of school, and any girl outside of school will be a group that needs to be considered as a hard to reach population in this case. So yes, Amadou, to your point, every platform needs to be a potential contact point. Teresa, I wonder if you could comment on that, and then perhaps also there's a question that's come in about the benefit versus the risk of giving anti-helminths in the first trimester of pregnancy. So I'm going to give you a double question, one on hard to reach for STH, and a second one of the question that's in the chat.
So for the hard to reach, what we want to do is we want to, as Amadou has said, take advantage of any opportunity that a woman might come in contact with the healthcare service. So when she has a baby, the well baby clinics that she comes to, or that the health services go to the household to provide postpartum and well baby clinic preventive health measures. That's a really important aspect. We're also now looking at market opportunities. So many women participate in market activities during the day, so they're not at home, and that's another area. Mobile clinics is another one. So there are opportunities. It's very setting specific, and that needs to be understood, and that's why a little bit of qualitative research needs to go into actually to identify what the best opportunities are. With respect to first trimester administration, of course, it's not recommended, but it has been done. It is usually done inadvertently, but a recent systematic review, in fact, that I did, showed that, in fact, there was no differential harm to either mother or baby from inadvertent administration or receipt of deworming during the first trimester. So even though it's not recommended, we know sometimes it occurs, but it does not increase the risk to either mother or baby.
Thanks, Teresa. And we've unfortunately have come to the end of our discussion time, but if there are, I see there's another question that's come in. What we will do is we're noting all of the questions, and we will reach out in a follow-up email with some responses on that. I just want to, before I hand back to Eva to wrap up, I want to highlight, it's been brought to my attention that today is the International Day of Women and Girls in Science. So a nod to my panelists here, and Amadou as a supporter of women scientists, but just noting that day today, and also noting the incredible contributions to this field that we've had from Dr. Mwele Malachela, who passed yesterday, who was the prime driver behind the WHO NTD roadmap that I presented earlier, and a great champion for gender and equity and women and girls' health. So I just want to acknowledge her today before I hand back to Eva. So thank you for our panelists. Thank you for your remarks. I know that you remain available to share experiences, and we will share Marion's FAQ document with everyone here that NI has produced, as well as the policy document in a follow-on email. So as I will hand back to Eva to just share with us our next steps in terms of what we hope will come forward in Canada to further support the global NTD goals as we work to achieve the Sustainable Development Goals. So Eva, I'll hand back to you, and thanks to our panelists.
Thank you, Allison and panelists. What a wonderful session, and so much information, and so important, the work that's being done. So in terms of next steps, where are we going now? So ahead of World NTD Day this year on January 30th, Global Partners launched the 100% Committed campaign to kick off endorsements and commitments for the Kigali Declaration. So the Kigali Declaration on Neglected Tropical Diseases is a high-level political declaration which aims to mobilize political will and secure commitments to achieve the SDGs, SDGs Goal 3 on NTDs, and to deliver on the targets set out in the World Health Organization's Neglected Tropical Disease 2030 Roadmap. The intersection of the roadmap and the Feminist International Assistance Policy are clear. Ending NTDs will result in better health for women and girls all over the world. So we, the CAGH and CNNTD, are calling on the Government of Canada and Canadian partners to endorse the Kigali Declaration and support the WHO's ambitious goals to end the neglect of NTDs and work towards global health unity. To find out more, we have included the link to the endorsement page in the chat box. Please reach out if you'd like more information about what the Kigali Declaration means for your organization. And I'd like to leave you with the voices of fellow Canadians and our global partners urging the importance of Canada's endorsement of the Kigali Declaration. Let's make sure that Canada is at the table. Thank you, and show video.
We have solved some of the greatest public health threats in the world.
Yet more than 1 in 5 people
still live at risk of neglected tropical diseases.
The worst part is
NTDs target our most vulnerable.
La meilleure partie est que
we have the tools to prevent
and treat NTDs.
We can bring about
un monde meilleur.
As Canadians
and as global citizens,
we are asking Canadian leaders
to take a stand
and sign
the Kigali Declaration,
joining the global NTD movement
so that we can prevent
and treat these diseases.
Let's commit
100%
pour construire un monde plus sain
by ending the neglect
of neglected tropical diseases.
So thank you, everybody, for joining us. And looking forward to seeing you again and to seeing all these signatures and support for the Kigali. And thank you to everyone behind the scenes who helped make this webinar work so well. So that's that would be Olivia and Tina Lines from NTDs, who is also the main contact for any questions or any follow-up to the webinar. Thank you so much, everyone. Bye.
Bye-bye. Thank you.